We currently operate 3 early childhood programs. The first is the Martha's Vineyard Family Center, which offers parent education workshops, parent support groups, parent-child activities, as well as individualized family supports. It's important to note that those services are open to all families in our community, prenatal, pre-adoptive, all the way up through age 8. Our second program is our home-based Head Start program. That program targets families with preschool-age children living at or below the poverty line. Recognizing that parents really are their child's first and most important teacher, in that program we work directly with parents in the context of the home or the community, helping them to understand and support their children's development. Our third program is our Early Education and Care Center, which Beth referenced. That program serves infants, toddlers, and preschoolers. We're here 9 hours a day, 52 weeks a year. Currently, our program is the only one on the island that holds a contract with the state to offer subsidized slots for income-eligible families, as well as supportive slots for families who've had a substantiated case of abuse or neglect. We've seen a significant increase in the number of children that we're serving who've experienced childhood trauma, typically related to parental substance use, mental illness, or domestic violence, often some combination of all three. And the impact of childhood trauma is profound, which has meant that we've really had to build capacity within our staff in order to meet the complex social and emotional needs that children are presenting with. The pandemic pretty immediately shone a spotlight on the foundational role that our early childhood programs play, both in our economy, as well as in the health and well-being of our community. Our Family Center and our Head Start program pretty immediately shifted to a virtual platform, which allowed us to serve families without disruption. We knew that social connections play a vital role in strengthening families, so we prioritized relationships, and that allowed us to truly understand and meet families' needs as the pandemic evolved. That included virtual parent support groups. It included delivering educational materials to families so they could play and learn together while at home. It also included what Beth mentioned, connecting families with valuable concrete resources. Our Early Education and Care Center presented the biggest challenge, as those services must be provided in person. When the governor shut down all schools last spring, we made the decision to reopen as what was called an exempt emergency child care center. And what that allowed us to do is continue to serve the children of essential workers and also vulnerable families in our community. I was very fortunate that we had 2 teachers who volunteered to operate the program alongside me. It was without a doubt the most challenging experience I've had as a teacher, but also the most rewarding. To offer a few examples of the impact that we had at that time, we cared for a 3-year-old boy whose single mother was working as a VNA during that shutdown period. We also cared for 2 school-age children whose parent was pretty recently in recovery, and prior to joining our program had been traveling to a methadone clinic on Cape Cod several times a week with her children in tow. When we reopened for regular programming last July, we experienced a devastating staffing crisis. It was around that time that Beth Focarelli joined us, and she recognized that if we wanted to invest in the future of the children and families in this community, we really needed to invest in our workforce. We had educators who were hesitant to return to the classroom because they felt scared. The pause provided by the pandemic really also helped them to understand that their work had been undervalued and undercompensated for many years. So we developed the Pathway program, which is a financial incentive program designed to attract and retain teachers who are passionate about what they do, who are committed to ongoing professional growth, and to reflect the diversity in our community. With the development of the Pathway program and the construction of our state-of-the-art new early childhood center, Community Services really has committed to serving children and families in this community for generations to come. However, it is important to note that we will continue to rely on the support of our community in order to offer the program that we feel all children deserve. What we collect in tuition from families and the limited funding that we receive in subsidies from the state does not come close to covering the actual cost of care. So what that means is we will continue to rely heavily on philanthropic dollars in order for our program to survive. In close, the pandemic presented challenges that I know none of us ever imagined were even possible. It also, however, taught us some really valuable lessons. In our case, we were able to rebuild our early education and care center with a much stronger foundation. And we also had the opportunity to really reimagine what the future of our early childhood programs might look like. And I look forward to continuing to be a part of this organization and working with all of you for many years to come. I will